Hello there. Welcome to another edition of Ogun State Weekly. I am Henry Ogunjimi.
And I am BC Adebayo. Last week on our debut, Governor Idi-Aba put Ogun State Weekly on track when he reeled out his 5 cardinal programs for the state. The governor, speaking on his mission to rebuild Ogun State, explained why education enjoys the largest chunk of the state's annual budget.
Today on the program, we shift our focus to the health sector. A sound health is key for a citizen to enjoy the developmental projects put in place by any government. And knowing this, the Ogun State government is providing infrastructure and personnel in all primary healthcare centers, upgrading existing general hospitals and building new facilities when necessary, all in a bid to achieving efficient healthcare delivery in the state.
To shed more light on these activities of the state government, we have the Honorable Commissioner for Health in Ogun State, Dr. Olaokun Soyinka, to help us. But first, a quick break while you enjoy this report on Ogun State healthcare delivery.
Second on Governor Idi-Aba's 5 cardinal points is efficient healthcare delivery, which enjoys a huge attention of the state government. With over 100 and counting, primary healthcare centers and hospitals across Ogun State have been refurbished, rekitted, staffed, and in some cases rebuilt. One of such is the newly built 37-bed Totoro Comprehensive Health Center with state-of-the-art facilities and equipment. According to the Senior Special Assistant to the Governor on Health, Mrs. Foluke Bello, the facility, when commissioned, will complement existing facilities.
It's a comprehensive health center that can also serve as a secondary health facilities. We will not restrict any patients. Every patient is welcome into these facilities, and it's going to cater for all, especially to the community in this area.
At the State's General Hospital, where life is gradually returning after the medical doctors called off their strike, some patients laud the reforms in the health sector.
We cannot compare this state hospital with a private one in terms of facility and all what it takes to be.
One of the 5 points agenda of His Excellency Senator Idi-Aba is healthcare delivery to the people of Ogun State. And I think since coming in, the government has actually done well according to his words. Have been increased in human capacity, material resources to the hospitals. And I think that has translated a great deal to the work performance and the output of the medical personnel. Obviously, the patients are benefiting already. The government has done very well. There are a lot of structures and equipment that have actually been put in place to improve our performance. And academically, the hospital has been accredited for postgraduate training in general medicine and obstetrics and gynecology. So this hospital can actually train specialists who in future would be able to render healthcare delivery to the people of the state and beyond. So I think the government has done well, and I feel that they could actually do better than this so that we will all benefit and we will have a sustainable healthcare delivery in the state.
This, the Commissioner of Health insists, will have been better but for the years of neglect and decay in the sector.
Primary healthcare centers, actually 47 were renovated in the within the first year. And then after that wave of refurbishments, and when I say refurbishment, they were restored to full function. Boreholes were put in place, standby generator, the surroundings were fixed up, and importantly, staff were put in place.
Healthcare, like other sectors, is receiving adequate attention of the current administration. This, observers say, is evident in the health indices of the people of the state.
If you look at the 5 cardinal programs of Senator Ibikunle Amosu's administration, health was put as second on the list. And the first thing that this administration did, the governor, in fact, even before I came in, the project started, before the cabinet was constituted. In other words, it was a burning issue for the governor, and he set up a transitional committee, and they recommended refurbishments of primary healthcare centers. And as I arrived, the project kicked off, and 50 primary healthcare centers, actually 47 were renovated in the first, within the first year. And then after that wave of refurbishments, and when I say refurbishment, they were restored to full function. Boreholes were put in place, standby generator, the surroundings were fixed up, and importantly, staff were put in place. In addition to that, looking at the secondary sector, the hospital management board and the teaching hospital, there had been a massive drain of staff. So really what people were complaining of is going to the facilities and having to wait for hours and still not even get to see healthcare professionals. So one of the urgent things that the governor did was to allow us to recruit staff. So by upgrading the facility, the existing facilities, and putting in healthcare workers, we at least laid the foundation for taking things forward. And I think, you know, there was a noticeable difference. Now, there have been years of underinvestment in the health sector, and it's going to take a while to turn it all around. But one of the other things we did was the whole health sector went on a retreat, and we looked at some of the critical things that needed to change that are maybe not visible, but they're systemic. They're parts how you begin to fix the health system. The best way to visualize the health system is like a machine. It's like a car. All the bits have to be functioning, particularly the bits that support the functions of service delivery. It's one thing for a doctor to write a prescription. It's another for the drug to be available, for it not to be fake, and for it to be affordable. And so we had a look, for example, at our system of procurement and supply of drugs. We entered into what we call a framework contracting arrangement with drug companies, where you have an agreement to buy a selection of drugs over a period of time. What that does is you guarantee the quality, and of course you get a discount for staying with that, signing that agreement with that company. So we crash the price of many drugs, which of course goes through and benefits the patient. At the same time, we guarantee the quality because we're dealing directly with a manufacturer. Now that's something that's not very visible to people, but is making a difference in healthcare delivery. We came up with this idea of devising an Ogun State model of community-based health insurance. When I say an Ogun State model, we looked very closely at what would stop people. We did some research in communities to see the acceptability, to see what people would want to, how much they would want to pay, for example, and introduce some unique factors like we're developing a system for people to swap goods, you know, yams or fishes if you're a farmer or a fisherman. If you're not very cash rich, but you have produce, to create a market whereby you can actually get health credits which will go towards your insurance. So we've put in things that I think are unique to Ogun State. But the idea anyway is that people pay a small amount regularly, and then they get, they're insured for anything that happens, particularly, of course, childbirth, antenatal care and childbirth, looking after common childhood illnesses and so on. And then once they pay their premium, then they access the healthcare for free, and the government subsidizes. So if you're registering, for example, you pay $4,000 a year, the government will pay $3,000 a year, and then any problem you have, you go to the clinic and you're treated for free. Then the pregnant women, the government pays the whole premium, so they don't pay anything. So they just get antenatal care and delivery for free. So we've launched it. We're in the pilot phase. It's going very well. We're fine-tuning our technology, and then it's going to, in the next few weeks, we're going to begin to roll it out. And other recruitments on a smaller, ongoing basis. The total is around, let's say, around figure 1,500 medical staff. Now that says a lot about, because I'm not talking about replacing staff, I'm talking about new positions. Of course, there are new things like building back up the ambulance service, and I mentioned a few other things, you know, nurse tutors in our nurse schools and what have you. But those are net increases, and that tells you how badly neglected over many, many years the health service has been. For any sector to have that many people missing. And not only that, we're not really back to full strength. So you can imagine how many people are missing from the health sector. But you know, the governor is turning it around, and we're embarking on another phase again, which will be more like another 500 staff coming in. So it's a long-term vision and steady improvement all the time. Now, with regard to the insurance, the premium covers you for, it doesn't, the amount is not, it's open. That doesn't mean that someone will come and just drain the system by getting endless healthcare. There's a defined package, the most common illnesses, and it's basically primary health care. There is some cover for some emergency surgeries. There's cover for 24 hours emergency treatment if, for example, you have an accident. There's cover for some basic surgical procedures. There's cover from dental, primary preventive dental care. And so it's a benefit, what we call a benefit package. There's a list of things that's the most common things that people need to have dealt with that are covered. But if you do have to pay for something that is not covered, you know, if you had, you know, maybe required some significant surgery, all that secondary care, that is not covered under the program, because really it's devised to provide free healthcare for pregnant women and children. But the